Welcome back to our Dan Education series on the heart, health and diving. We're in Chapter 4, which deals with ischemic issues, and we're now dealing with Part 4 that addresses issues that are particular to women. Now, heart disease is the leading cause of death in women as well as in men, and myocardial infarction remains the leading cause of hospitalization. The characteristics of the disease in women may differ from those in men, and the age of onset, presence of risk factors, probability of aggressive diagnosis, and even the likelihood of appropriate treatment vary in men and women. For example, heart disease develops 7 to 10 years later in women than in men, possibly because of the protective effect of estrogen. Myocardial infarction is less frequent in young women than in young men, but young women who have a heart attack are at greater risk of dying within 28 days of their attack. The common risk factors for heart disease have a similar predictive value for men and women. However, men more frequently have smoking as a risk factor, whereas women more frequently have hypertension, diabetes, or high blood fats and angina as risk factors. Although women typically smoke less than men, the relative risk for a heart attack in women is 1.5 to 2 times greater than that in men who smoke. Typically, and especially I should say, in those less than 55 years old. A higher prevalence of diabetes also contributes to higher mortality rates from heart attacks amongst women. Women receive fewer advanced diagnostic tests like coronary angiography and fewer interventions like coronary artery bypass grafts. These differentials may be due to the fact that acute heart attacks are likely to occur at an older age in women, or to the presence of other associated diseases, but could also be due to delays in admitting women to the hospital. Symptoms of heart attacks in women are usually the same as those in men, with chest pain, that is angina, being the leading symptom. However, women are more likely to attribute their symptoms to acid reflux, flu, or normal aging. In addition, chest pain that women experience does not necessarily occur in the center of the chest or the left arm. Instead, women may feel pressure in the upper back or a sensation of squeezing like a rope tied around them. Although 90% of women who suffer a heart attack later admit that they intuitively knew that it was the cause of their symptoms, at the time often discount them or attribute them to something else, or take an aspirin and delay calling the emergency services. This decreases the opportunity to preserve their heart from damage and lowers their chances of survival. Here are the most common symptoms of a heart attack in women: uncomfortable pressure, squeezing, fullness, or pain in the chest, especially in the center, but not always. It lasts more than a few minutes or goes away and comes back. Secondly, pain or discomfort in one or even both arms, the back, neck, jaw, or stomach. Thirdly, shortness of breath with or without chest discomfort. Fourthly, other signs such as breaking out in a cold sweat, nausea or lightheadedness may be part of the picture. And fifth, as with men, women's most common heart attack symptom is chest pain or discomfort. Women are somewhat more likely than men to experience some of the other common symptoms, particularly shortness of breath, nausea, vomiting, or back and jaw pain. We hope that this has been useful in sensitizing women to their chances and the presentation of a heart attack. Please don't delay in seeking medical advice. Thank you for watching this series and continue supporting Dan and subscribing to this channel. Thank you.